And we are recording. We are all set to go. Have all of our amazing co-hosts here with us and our special guest that we are just so honored to be able to host every Friday on Ask Doc Live. My name is Rebecca Dukes-Kozak, and I am joined today by my co-hosts, John T. McCollier, Ruth Ellen Sanchez, Dr. Judy Reynolds, Heather Bowen, and Nasima Omar. And we are here because we have this passion to be able to share information that is empowering to everybody. Everybody's whose ears hear, we're planting seeds. And our hope is that those seeds will start to grow and helping people realize that there's a lot of different sciences out there, folks. Some factual, some not so factual. But when it comes to having scientific evidence through autopsies and through research that is done by the person who actually did the autopsies and comparison, I mean, there's so many things that our special guest has done that has supported the information that we are sharing here on Ask Doc Live each and every week. Now, Ask Doc Live is sponsored by AskDocLive.com, but it is very important. If this program was shared with you by somebody specific, somebody that you met online, somebody that you know personally, get back with them, because what we're sharing as a resource. They have their own specific ways that they can order the product that you need in your hands. And since they're the ones that referred you to this program, make sure that you get back with them as a thank you, even if it's just to say thank you verbally, but get back with them if you want to order anything and get more information about what you hear today. Again, my name is Rebecca Dukes-Kozak, and I am going to be your host for the next 2 hours of Ask Doc Live. This program is not meant to treat, diagnose, cure any diseases. We are here to provide information only and just give an education on how important it is, because our food supplies are empty, folks. They can say, eat a healthy diet. Well, whose healthy diet is healthy? When you, all around the world, and you're going to hear it in today's presentation, minerals are like, was it chocolate fudge ice cream with those little swirls and those ribbons of fudge through it? They're not even throughout the ground. And if the minerals are not in the ground, the food that is grown in that ground is not going to have it. So that's where being intentional in what you put in your mouth and on your body and have around you affects how your body's genes are going to respond. And that's proven in the science of epigenetics. Epigenetics is something that our special guest today was part of finding, as he is one of the co-founders of the science of epigenetics. Now, as I had mentioned, that the products discussed are not intended to diagnose, treat, cure, prevent any diseases, and the information contained in this Zoom is for informational purposes only. If you are pregnant, nursing, or taking medications, please consult your healthcare professional before starting any supplement program. Now, we are using food as medicine, and to guide us through what are the best absorbable options, we have the one, the only Dr. Joel Wallach. Welcome, Dr. Wallach, to Ask Doc Live.
Well, thank you so much for the kind introduction, Rebecca, and thank you to your whole team. My gosh, what an illustrious team you have put together here to get this information out. And it's so important, this basic stuff. And we want to give a little brief information this morning on a disease that's impacting humanity all around the world, is Alzheimer's disease. And there's so much misinformation associated with it. And some of it was intentional, criminal misinformation, and, to get grants and things like that. And some of it is just ignorance. Well, let's look at some basic stuff. Oops, we can't have buglers on when I'm talking. All right. So get on them, John T. At any rate, what we do know is that 15% of people over the age of 65 are diagnosed with Alzheimer's disease. 50% of people over the age of 85 in America are diagnosed with Alzheimer's disease. Let's see here. We know that and this goes back to 2006 when there was a major paper published by the University of Minnesota. And I think there was somewhere between, depending on whose version you read about this, there's anywhere from 12 to 20 different co-authors and contributors to this article. Okay. And they came up with the idea that the basic cause of Alzheimer's disease is an accumulation of amyloid plaque. And this came out in 2006. Okay. Well, it turns out that 25% of the normal brain weight of human beings is cholesterol. 25% of the normal brain weight of human beings is cholesterol. When you look at scans of people with Alzheimer's disease, when you look at scans of people with MS, multiple sclerosis, and Guillain-Barré syndrome, which is MS in kids under the age of 25, same disease as MS, and Alzheimer's disease has many of the same symptoms as MS and Guillain-Barré syndrome. And then, of course, there's osteoporosis of the skull, which we have a book that's been out now. It's been out for and in use for, maybe 14 months, couple of months past 2 years. Past a year out. And it was very obvious that we hit the nail on the head with that. And yesterday we had a wonderful meeting, which we do every other week in, let's see here, in the Philippines. Okay, and we had a gal in there. She's from New Zealand, and she was 65 years old, and she had like 25 different health issues that she was interested in herself. And I'm getting information here that there's a basic underlying problem here. And I asked her many questions. There you go. And we'll get to the CD is by the same title. It's all in your head. And we'll get to that in a minute. Of course, Rebecca is a co-author on the CD. So she interviewed me, and she did a great job putting that together. And we'll get to that in a minute. Well, but last night, I asked this gal, she's 65 years old, and I asked her a question. Do you ever get up at night to urinate? Because she had like 20 different symptoms, but she didn't say anything about getting up at night to urinate. She said, well, yes, I do. I said, well, how many times do you get up? Once, twice, 5 times? She says, 8, 10, 12, 15 times I get up. I'm getting up every half hour to urinate. Okay. Well, this is called polyuria. Not like Polly wants a cracker. It's not kidney disease in parrots. Okay. But poly, from the scientific standpoint, meaning many, okay, urinations, okay? And this is due to osteoporosis of the skull, squeezing the spinal cord as it's coming out of the back of the skull. And the spinal cord is telling the urinary bladder to urinate. And it's not a prostate problem because women don't have prostate glands, but women do have 4 times the rate of osteoporosis. So it all kind of fit. And she was just like went crazy when I told her what her problem was, and her problem also contributed to everything else. And this is where Rebecca was holding up the book. It's all in your head. Originally, I thought there was 25 different diseases that were caused by osteoporosis of the skull. And I actually got an award from the United Nations. It's called Lifetime Achievement Award for Natural Medicine. They've only given out 3 of those awards over the 100 years they've been around. It's not an annual award, but they give one when something. So I discovered all this stuff going on with osteoporosis of the skull. and these 25 different diseases. Well, it turns out there's actually 37 different diseases that are caused by osteoporosis of the skull. And some of them are also related to MS, multiple sclerosis, because you get the same symptoms of multiple sclerosis and osteoporosis of the skull, and Guillain-Barré syndrome, and Alzheimer's disease. And the subtitle of our CD that Rebecca and I did is, see here, How to Prevent and Fix Osteoporosis of the Skull and MS. And when we run out of these, we're going to have to reprint it. We're also going to add How to Prevent and Fix Osteoporosis of the Skull, MS, and Alzheimer's disease, okay? Because we know the answer to all these now. And so we're very, very excited about this. Now, if you buy the set, if you buy the book and the CD, you get a nice little discount. If you buy 10 sets, oh my gosh, you get a big discount. We really want to encourage you and give you a big financial break. If you buy 10 of these sets, the book and the CD, it's all in your head. You will help your church community, your family community, your community at the place you work, your neighborhood. Get the Scouts, Boy Scouts and Cub Scouts involved, get the Girl Scouts and the Brownies involved. That's one of the things I did when I started the company, was because I was a Eagle Scout and ordered the arrow and all that kind of stuff. I was a Scoutmaster. And so scouting is a great source of warriors, people who want to contribute to the benefit of the community that they're in. Okay. Excuse me. And what better thing for the Girl Scouts and the Boy Scouts to do than to give many healthy years to the community they live in. Okay. And so they get their merit badges and they get their awards and so forth by doing these community things. So get them involved with longevity, get them the information, give them the tools, teach them what they need to know. And so, get them on epigenetics, the death of the genetic theory of disease transmission, get them the book Hell's Kitchen, which goes into all the bad things that happen because of improper cooking, nutritional deficiencies of the food, bad fuels that we use for cooking, all this kind of stuff. And so that book was named Hell's Kitchen after that district in New York City, Hell's Kitchen, where everything bad happened. So they named it that district Hell's Kitchen. So we took that name and put it as the title of the book, because the same thing happening here with nutrition. When everything bad is happening, it's Hell's Kitchen. It's the cooking methods. It's the nutritional deficiencies. And my doctor said, don't waste my money on taking vitamins and minerals. Just eat well, I'll get everything I need. And Rebecca said one of the most important things that anybody can say. Nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. Okay. Also, plants do not make minerals. Plants can make vitamins and amino acids and fatty acids, but plants cannot make minerals. Plants only need 3 minerals, NPK, to produce seeds and the next generation of that particular plant. And so you're only 57 short if you have only those 3. Okay. So you have to consciously, proactively do the right thing. And that's why we have the CD in the book. It's all in your head. That's why we have the book Epigenetics. That's why I have the book Dead Doctors Don't Lie, which started all this. Okay. Okay. People always ask me, well, how'd you get involved in this, Wallach? You were just a veterinarian. Well, yeah, but I discovered the first mass die-off in America from pollution. Okay, got it published in 1965. And when I was in Africa working on the White Rhino Project to save the white rhino, there was only 300 left in Natal, South Africa. Now there's 21,000 because of our efforts of building wild animal parks. And also we used a tranquilizer. It was 10,000 times, there you go. The tranquilizer is 10,000 times more potent than morphine. So we didn't have to use darts the size of a can of Coca-Cola or a Rebound or something like that, or a flashlight. We were able to use tranquilizer darts the size of a AAA battery and knock down these rhino and get them into boxes, train them. There's only 300 left. We brought 200 back to the United States. And today there's 21,000 in Africa because of our work. So we're very, very proud of that. And this all goes back to this basic stuff. Okay.
So, Dr. Wallach, if I may
yeah.
interrupt you, because there's a
please.
portion of that story that you don't share that I think is so vitally important. In your research and preparing and bringing these rhinos back to the States,
Hmm.
You are working on creating actual wildlife reserves there in Africa,
That's correct.
creating habitats that then provided the nutrients needed that were missing, that were the underlying cause of their die-off.
That's correct. Yeah, we built waterways. We built ponds and lakes to put water in the Tal and Zululand, South Africa. And today, those big wild animal parks we established back in, see here, it was 1965 to 1967 when they got the grant and pulled me out of Africa. We had already brought back 200 white rhino in the United States, but they had to be trained. It took anywhere from 4 to 6 to 8 weeks to train them to live in this box, because when we shipped them from Africa to the United States, they were on a boat in this box for 2 to 4 weeks, to 6 weeks sometimes, depending on what route they took. Okay. And so they had to be fed and cleaned up after and watered and everything and taken care of in those boxes for anywhere from 2 to 6 weeks. And we had to train them to do that. And so, I mean, all this was going on. Okay. And there's pictures of all of the various people who were involved in that project, Operation Rhino. Okay.
Yeah,
and
there's
and
lots
then,
of pictures.
yeah, lots of pictures, Rhino Express. So there's no doubt I'm telling you the truth, because you can see everything I've just described to you, the photographs that were taken in there and put in, the proper perspective, and sequence and everything as things were happening. We're trying to save a species. We're down to 300 individuals by actual count. And today, by actual count, as of December of last year, was 21,000. So we're so very proud of all the work we did to save the white rhino. And that is a result of all the work we did and published in Rhino Express. This is a great book for kids who are interested in conservation, working with wildlife, because it tells you, we didn't have a lot of money, but we had willpower and we made it happen. And so Rhino Express is a great book for kids who are in the scouting, both for girls and boys who want to get into the wildlife management thing, who want to save wildlife, who want to save the earth, because if we save the animals, we save ourselves. So thank you so much, Rebecca, for getting that CD out. It's a great summary of all the good work we did in Africa, and the book, It's All in Your Head, very important. The 25 different diseases, the book, It's All in Your Head. But now when we get down to the last couple of cases of that book, we're going to reprint it, but it'll have another chapter or two added to it to add those other diseases that are attached to osteoporosis of the skull, MS, and Alzheimer's disease. Okay, over to you.
All right. Thank you so much, Dr. Wallach, for that introduction. And, that's pretty big. And it really makes you think, folks, that you get research and it's printed, and then it's 16 years later, even the writers that were involved in that research are admitting it was not truthful. Well, Dr. Wallach has been sharing the same story for decades. And he is published many, many times. I'm working on getting an actual count of how many publications, books, CDs, brochures, all of these medical journal things that have been published with his research information, and things are continuing to be correct after all these years. And that's one reason why I am so proud and honored to be able to host this program and bring this information to you and make sure that it gets spread around the world, because it doesn't affect just one community, one family, one culture. It is worldwide. And hello, Dr. Milan, welcome. We love to see you as well. It's all right, Doc. It's all right, because she was so instrumental in all of this, or most in this research and the writing of the books. I mean, her name's on there too, and she's a brilliant mind as well.
And so, okay, Milan, come here. Rebecca is saying good things about you. Okay, she's saying good things about you for all the good work you did and all being a co-author and all the books and articles. So she's very shy.
She is shy and she's very humble, Dr. Wallach. And I just love and appreciate that quality about her. And there are peoples to know them, to love them. It's just holds true all around. Well, Dr. Wallach, let's go ahead, and we have some hands that are up already. And the first hand that we are going to go to, and oh, she does have some audio today. Wonderful. Brenda Teresa, go ahead and unmute yourself. You are the first hand up in our lineup. Welcome to Ask Doc Live.
Thank you. Good morning, Dr. Wallach.
Good morning. How can we help you?
Well, I know a man from the UK. I'm a distributor since August 2015, and I know a man from the UK who has a female cat that was recently diagnosed with pancreatitis. She is on high protein, grain-free food, but struggling to eat. But now, under the care of the vet, I guess she's getting better. She's asking for food. She's highly allergic to dairy. Her blood sugar appears to be okay and not pre-diabetic. And I did give him the instructions for Arthrodex and EFAs as well. So what can we do to help him with his sweet little baby?
Okay, well, that cat should be getting a commercial cat food, a moist cat food, canned cat food, instead of, giving it fish. And I'm getting the idea that this guy's just giving fish or meat or chicken livers or something to this cat. But it needs to get a high quality brand from the UK cat food, canned, added the Arthrodex to it. And then don't forget the EFAs, one EFA and one EFA plus. The EFA plus is from fish livers, and the EFAs are from grains. Those essential fatty acids are important here. And I think everything will come right. Okay, this is, cats have 9 lives, remember.
Right. Do you suggest any ultimate enzymes or anything like probiotics or for cats like that for him?
Not really. Just that commercial can of moist cat food, and it can be made out of fish and chicken and beef or whatever it's made out of. But it does have to have the vitamins and minerals added to it, and then add the Arthrodex. It's 1 scoop for 20 pounds of body weight. So if the cat weighs 8 pounds, it'd be half a scoop. If the cat weighs 5 pounds, it's a quarter of a scoop of the Arthrodex. Okay,
sounds great. Thank you.
Thank you.
You're welcome.
All right, thank you so much, Brenda Teresa. We are working with the most famous, wonderful, dynamic vet in the world, because that's where he started, folks. Well, no, he started healing himself, and then he went into agriculture and veterinary medicine and found, which he did not mention, he found the very first non-human case of cystic fibrosis, which was then found in that whole colony.
Yeah, it was just the Yerkes Primate Center at Emory University. I was a pathologist for NASA at that time, and when I found out that it was a nutritional deficiency, by sending slides to 5 different medical schools, and I didn't tell them it was from a monkey. I just said, I think this is from cystic fibrosis. What do you think? And they all wrote back in their letterhead. Remember, this is 1977. Oh yeah, this is a classic example of cystic fibrosis. And then I told them it was from a monkey. And at the very least, we had an animal model now, and they went crazy positive until I asked them, let's do biopsies in the other 24 baby monkeys in the colony. And they all had cystic fibrosis, all had different mothers and fathers. I said, well, this can't be genetic. This has to be a nutritional deficiency thing. And they fired me. And that's when I went back to school and became a physician.
And you took that information, Dr. Wallach, and you have helped so many children, and also the prevention of it.
Yes, well, our attorney, Jonathan Emord, and I spent 25 or more years in federal courts petitioning and suing to get these nutrients into baby formulas. We finally got it done. And in the early 1990s, suddenly now cystic fibrosis disappeared. Suddenly now muscular dystrophy disappeared. Suddenly now Sudden-Death syndrome disappeared. Now it shows you how silly the medical system is, how tragically silly they are, because from the Sudden-Death syndrome, SIDS, what did doctors say caused SIDS? They said that mothers were laying on their babies in the bed and suffocating them during their sleep. And for 25 years, these mothers, where the babies were dying of sudden death syndrome, they're committing suicide because their churches were excommunicating them, their families were excommunicating them, their neighbors were dissing them because they had killed their own baby by sleeping on them. Well, that wasn't true. They were dying of hypertrophic cardiomyopathy heart disease. And Dr. Milan and I went to China. We did 1,700 autopsies on kids that died of Keyshan disease, which is hypertrophic cardiomyopathy heart disease, and got it published. And I said that earlier, I think. I got the Lifetime Achievement Award on Natural Medicine from the let's see, what is it?
It's the Lifetime Achievement on Natural Medicine and Philanthropy from the United Nations headquarters.
From the United Nations. And that's the United Nations giving me the award there at their headquarters in New York City. Okay. And they only gave out 3 of those awards since their beginning. They don't give it every year. They only give it something extraordinary. And the discovery that sudden death syndrome was not the mothers laying on their babies was it, okay? That came out in 2015, okay? So very, very proud of that award.
Well, it's definitely something, Dr. Wallach, that you should be proud of, because that is continuing. It's not just something that you hang on the wall. It's something that you use every single day. That information in helping people.
That's right.
You're not keeping it to yourself. And that's our goal, is to not keep it to ourselves, because it is life-changing that you're not going to hear about on TV. And a lot of people are just plugged into TV and all of the things that are going on. Well, let's spread some good news. Let's spread some hope. Let's spread that we as people are empowered of our own health journey. Let's go to the next hand that is up, Dr. Wallach, and that is Vicky. Vicky, go ahead and unmute yourself.
Okay, you hear me?
Yes, ma'am. If you'd like to come on camera, you're more than welcome to do so, but you're on live with Dr. Wallach.
Okay, hi, Dr. Wallach. Thank you for taking my call. I called you back at the end of May, and I had started longevity about a month before. And I called you mainly because of migraines. I've got herniated cervical disc. And basically, I kind of wanted to give you an update and ask a question also. One of the things I didn't mention was that I had restless leg, because it was just mainly an annoyance since, it wasn't primary. Anyway, that has disappeared. All of a sudden I wake up, I'm reading an article about somebody having restless leg. I'm like, wait a minute, I don't have it anymore. So that has disappeared and my migraines have reduced. Okay, my question is, you had recommended I go on the collagen. I got the collagen peptides and I was taking them, but I was getting a lot of gas. So I ended up stopping them, and I wanted to get your recommendation of what to take instead of that, or what's going on with that. Maybe I should.
So how much you weigh? How much you weigh?
Oh, I weigh 126. I'm 5'3".
And how old are you?
67.
Okay. Do you have any ringing in the ears or tinnitus or dizziness?
No.
Okay. How many times do you wake up at night to urinate? Once, 5 times, 10 times?
Maybe once.
Okay. And let's see here. Do you have anything going on with this restless leg syndrome? Do you have anything going on in your lower back? Have they talked about surgery in your disc? Have they talked about hip replacement, knee replacement, anything like that?
No.
Okay. All right. Well, you have a combination of things, which is not unusual. Okay. Have multiple problems. The restless leg syndrome is caused by osteoporosis of the skull, squeezing the spinal cord. Okay. The degenerative disc disease, you have headaches. Okay. These migraine headaches go along with trigeminal neuralgia, which is the 5th cranial nerve being squeezed. You get headaches behind the eyes, on the temples, on the cheeks, and behind the ears, and all this kind of stuff, big headaches. Okay. That's the 5th cranial nerve being squeezed by the skull. And so at 126 pounds, with all this stuff going on here, I'd have you take one healthy brain and heart pack per month, a half a dose of everything twice a day. But I want you to take an extra bottle of ursulene, not from Walgreens, but ursulene with 5 cofactor. That's very important here. I want you to take 3 of those selenium twice a day. And then I want you to take the collagen peptides, take, let's see here. I want you to take a scoop of that, your breakfast drink, again, a scoop of your evening drink. I want you to take 2 bottles a month of our MSM. So you can take 3 at breakfast, 3 at lunch or dinner time. They're going to help rebuild the disc between the vertebrae, all the bones in your legs and back and so on in your skull. And so this is, you need to take more than just one product. You need to take the 90 essential nutrients, again, that healthy brain and heart pack. And so it has 215 nutrients in it, including the basic 90, which is the core. And it's the fact that, you know, you're not doing it all and you're seeing improvement here, there, and yon. So let's get it all going. Okay.
Well, the thing is, I'm getting gas from the collagen. That was my concern.
Okay. Well, if you're concerned about gas from the collagen, what I would do is, as you say, take the ultimate enzymes, go ahead and take 2 or 3 of those, say 5 or 10 minutes for each meal, a couple ounces of water. Okay.
Okay. I have one last question. Okay. I have a dog who I think has pica. I don't know if I'm pronouncing it right. He's a 9-month-old, 30-pound dog, and he's eating drywall. I thought maybe he has a mineral deficiency or something. What do you think?
Probably does. What are you feeding him?
It is a brand that the breeder recommended.
Okay, is it dry? Is it dry dog food or canned dog?
It's dry, and then I add a little bit of this canned wet, which is a liver product.
Okay. Yeah. So you need to, I'd go totally for the canned product with all the vitamins and minerals in it. Make sure there's no gluten in it. Our Arthrodex at 30 pounds. It's a scoop and a half of the Arthrodex in the food. Don't forget the EFAs. I go ahead and give 1 EFA and 1 EFA plus in there. And then call us back in 2 weeks and 4 weeks and 6 weeks. I think you and the doggy will both be happy.
Okay.
Okay.
Thank you.
You bet. Thank you.
Okay.
All right. Back to you, Becca.
All right. Thank you, Vicki. So Dr. Wallach, we have several questions that are coming in the chat. So let's go to the first one, and we're going to try to hit these all in order. So David says, good morning. I've been eating gluten for 67 years. In the past 2 months, I have given up the bad foods and started on the healthy brain and heart pack. Question is approximately how long does it take for the intestinal villi to recover? 3 months, 6 months, 12 months?
I would say give us 90 days, of course, and that's assuming that they're taking the 90 essential nutrients. And better yet, if you've been eating gluten for 67 years, I'd have them take and I apologize, did he say how much he weighed?
No, he does not say.
Okay, well, let's just say, let's get him on 2 healthy brain and heart packs per month, the full dose of everything twice a day, the collagen peptides, a scoop of that at breakfast and a scoop at dinner and a drink, the MSM, 2 bottles of that per month, 3 at breakfast, 3 at lunch, 3 at dinner time. And it's, let's see here, vitamin D3, 3 of those twice a day. And these complaints will all go away. If he has some white gray and silver hair, the hair color will come back, because the loss of hair color is not due to aging, it's due to a nutritional deficiency. And the same nutritional deficiency that produce white gray and silver hair also cause plaque in the arteries and fibromyalgia and all kinds of other stuff. So you want to make sure that hair color is coming back, not because you're coloring it and dyeing it, but because your body is now producing the pigment because you're getting the nutrients. Okay.
Yes. And I know that it's possible because this spot right here used to be all white, Dr. Wallach.
Wow.
So yeah, I'm excited. Ruth Ellen had a message to her that says, would you ask Doc what the secret sauce is for vascular issues, especially in the lower legs? I've had both hips replaced, and I've been dealing with numbness in the upper legs and some redness or purpleness rather in lower legs, especially the left leg. I'm using the 2.5 pack and alternate with Ultimate Daily Classic and Pro Cardio FX. What else do I need? So this individual, and I love this Dr. Wallach, 80 years old,
Mm-hmm.
and she still realizes that the body needs nutrition in order to keep going, and you don't have to have pain going forward. So she
Okay.
is
Did she say how much she
5'4".
weighed? I didn't get that written down. Did she say how much she weighed?
Yep, she's 170 pounds at 5'4".
Okay. All right. Well, what I would do again, just for our greater listener population as well, get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat bioranos, no sugar, no carbonated drinks. And when I say no fried foods, I mean no air frying, no deep frying, no pan frying, no frying. Okay. And then absolutely no sugar, including no, let's see here, no carbonated drinks, because even diet drinks have carbonation. They'll neutralize stomach acid, so you cannot absorb minerals and digest food. You need your stomach acid. So 170 pounds, I want her to have 2 healthy brain and heart packs per month. Okay. 2 bottles a month of the MSM, so you can take 3 with each meal. That's going to help rebuild cartilage and ligaments and tendons and connective tissue and disc between the vertebrae and skin, walls of arteries and veins. Very important here for her. And then I also want her to have the collagen peptides, a scoop of that at breakfast, drink a scoop of that with dinner drink. I want her to have the, let's see here, she needs to take the, what did you have this morning?
Oh, what did I have this morning? I had a lot this morning.
No.
Dr.
No. You opened up a new bottle to take something.
Synaptive?
Synaptive, yes.
I had called you and I had shared some of the things that I was going over, experiencing after a little fender bender yesterday, and you suggested synaptive.
Yeah. Okay. Same thing for her. She needs a synaptive. Okay. She could take 2 or 3 of those twice, maybe 2 bottles a month of synaptive. I want her also to, let's see here, take vitamin D3 at her age. She needs vitamin D3, 3 of those twice a day. That's 2 bottles a month. And for the vascular stuff, I want her to get 2 bottles a month of the Ultimate Daily Classic tablets, so she can take 3 at breakfast and 3 at dinner time. And they'll support healthy blood flow through blocked arteries in the brain, the heart, the kidneys, the lungs, every place. She will, what should I say, make things happen by getting that blood flowing, and also support healthy blood pressure. Don't cold turkey off of any medication if she's on medication, but as the blood pressure drops, she can slowly reduce the medication. Okay.
All right. Thank you so much, Dr. Wallach. Let's go to the next hand that is up, and that is Richard. Richard, go ahead and unmute yourself. And if you'd like to come on camera with us, that would be fantastic.
Hello, doctor. Can
Hello.
you hear me?
Yes, sir. How can we help you?
Okay, let's see. I weigh 122 pounds. My weight, my height is 5 feet 3 inches. My age is 72, and I been diagnosed with advanced prostate cancer, and will probably have to go under some type of radiation treatment, is probably what they're going to suggest when I see them Monday. My concern is that they're talking about something called ADT, which is androgen deprivation therapy. And I was
Which means that they're going to, what that means is they're going to cut back on your male hormones.
Yes. Do you consider that good or bad?
Well, male hormones will drive prostate cancer. Okay. So, that's something that you have to pray on, decide that that's what you want to do. If you want to do that, it's going to, at the very least, slow down the growth of prostate cancer. Okay. So that's not a bad thing. And then sometimes you just have to have sex, even though you're not driven to have sex. You just have sex because you should have fun and all that kind of stuff. But it's one of those things where you're not going to be driven to have sex if you're taking those drugs. Okay. Then at your body weight, 122 pounds, I want you to have 1 healthy brain and heart pack per month to support the immune system. I want you to take a half a dose of everything twice a day, split it up. I want you to take, let's see here, 1 bottle a month of the MSM. So you can take 3 at breakfast, 3 at lunch, or 3 at breakfast, 3 at dinner time, or 2-3 times a day for a total of 6. And that's going to support the immune system. I also want you to take the collagen peptides. That will support the immune system by helping you make white blood cells and red blood cells and platelets and antibodies and so on in your bone marrow. Okay, that's going to help you a lot. And so that's where I would go there. Do not take any of the prostate support nutritional programs, Prostate and that kind of stuff. Don't take those things because you don't want to be driving. The nutrition can't differentiate between cancerous prostate cells and normal prostate cells. So you don't want to be driving prostate cells when you're being treated for prostate cancer. Okay. But you do want to take these nutrients, also the collagen peptides. Go ahead and take a scoop of that with your morning drink, a scoop of that with your evening drink. Don't forget the vitamin D3, 3 of those twice a day. And let's go there. Okay.
Okay. And the first thing you said was the health pack.
Healthy brain and heart pack.
Okay. All right. Fine. Thank you very much.
Yeah. Keep in touch. Okay. Let us know how things are going. Okay.
All right. Sure enough. Okay.
Thank you, Richard. Bye-bye.
All right. Thank you, Richard. And just so everybody knows, the replays for all of our programs of Ask Doc Live can be found on our website, askdoclive.com, including today's, which will be available through the weekend, or by the weekend, I should say, and then available for who knows how long. We have programs that have been on there for more than 2 years, Doc. I love the fact that we can use technology to be able to share. And we do encourage you that if you are on live with us or watching the replay, get back with the person that shared this program with you. They cared. They have a vested interest in making sure that you have better health because they want to keep you around, folks. I know for myself, I was in a bad place. And now to see other people struggling and hurting and in a bad place, it just breaks my heart because I know it's not necessary. You give the body what it needs, Dr. Wallach, and you've proven it time and time again. You put those nutrients into your formulas, they synergistically work together. You actually get absorption into the cells where the nutrition is needed, not just peed out into the septic system or whatever system you're on. The body can do some amazing stuff.
Yeah, with that said, I want to go back to that Minnesota paper that was written in 2006. We didn't spend much time on that. I think there's somewhere between 12 and 15 contributors to that paper. And it was considered the ultimate paper when it came to Alzheimer's disease.
Alzheimer's research.
And so apparently there's one or more of those authors that twisted the data a little bit and tinkered with the pictures of the damage in the brain, the demyelination of the brain, and so forth. And so they gave a lot of misinformation out when people inquired about more information and so forth. So they gave out a lot of misinformation. And it's coming back to haunt them now, okay? Because once very well-respected university of Minnesota, now their medical school is really under extreme scrutiny because of the misinformation perpetrated by that paper on Alzheimer's disease.
Yeah, most definitely. Most definitely. Now, Dr. Wallach, you mentioned collagen a lot.
Mm-hmm.
And Cynthia has a really good question. She says, can I sprinkle the collagen peptides and the OsteoFX powder on my food instead of putting it in my drink?
Yes, you can put it in applesauce. You can put it in your mashed potatoes. You can sprinkle it on your salad. It really doesn't have any taste. It's just kind of a white crystalline powder. It's made from collagen, from cartilage and ligaments and tendons and connective tissue from fish, poultry, sheep, and beef. It's really a very interesting product. And of course, our original collagen product was glucogel. Okay, that was our original that we put together with the Healthy Bone and Joint Pack for Theo Ratliff, the great basketball player, who came back from totally losing his contract. So he was 24 years old and had bone-to-bone arthritis in both knees, and his cartilage popped off his hips. He had a fracture in his wrist and a shooting arm. He lost his contracts. But after a year in our program, and we built the healthy, let's see here, the healthy
Bone and joint.
joint, yeah, healthy bone and joint pack for him with that collagen. Okay, the again, the glucogel. He came back and played for 11 more years and made over $100 million. Do you think he likes our products?
I think he might appreciate them just a wee bit.
Well, he's been very good about telling his story, and that's why we have his picture on the label of our cans and our boxes of Rebound. That's the guy who made it all happen, Theo Ratliff.
Awesome. And I actually, Cynthia, I mix my, I even did Rebound this morning in my plain yogurt, but I will mix my collagen in there. I will mix OsteoFX. I'll mix my tangy tangerine. Dr. Judy is holding up her cup where she has in there collagen as well. I know she is loving the collagen, and as a researcher herself and developer in the animal world of feeds, collagen is so important, not just for skin, folks. We're talking about every strand of connective tissue. We're talking about tendons, muscles, ligaments. For those of you who
Heart
love your
valves.
steak, those little, that marbling in there, you know, that's all part of connective tissue. And we need it in order to keep our connective tissue healthy and strong. Let's go to some questions. So in the chat here, Mark had asked, is there an upper limit to the temperature we should be using to bake food in the oven to avoid the acrylamide or other problems from overcooking food?
Well, of course, there's you want to, in fact, that'll be a good question to look up, and I'll have the exact answers by next week, okay, on that question. But you always want to, when it comes to meat, you want medium rare or rare. You don't want medium well.
Right. And you don't want to
Okay.
burn the fats, folks.
That's right. You do not want to burn the fats or connective tissue. And don't forget, your heart valves are made out of that same collagen. Your heart valves and all the tendons and ligaments that hold the heart valves to the heart muscle. And when the heart contracts, those ligaments and tendons pull the valves. And so that's how all those valves and everything work in the heart. But they require, even the heart and the covering on the brain, okay? The covering on the brain is made out of the connective tissue, okay? So you need that stuff for just about every tissue of the body: blood vessels, arteries, veins, lymphatic vessels.
Everything. And your hair.
Yeah, hair, because of the skin.
I was going through this morning getting ready, and then all of a sudden I just kind of like puffed my hair. I'm like, I have happy hair, Dr. Wallach. And one of the only things that I've done is I've added 2 more doses of collagen a day.
There you go.
I love it. Absolutely love it. Well, let's go to the next hand that is up, and Saint Theresa's iPhone. Go ahead and unmute yourself. And is it Therese, maybe? Go ahead and say something. I see you're unmuted. Hello.
Hello.
Welcome to Ask Doc Live. I'm not hearing anything.
Okay. Well,
So
maybe
the camera came on, but it's a black screen. So I'm wondering, maybe go back out of the meeting and come back in, and let's see if we can get a better connection for you. And while she's doing that, we've got a few more minutes here. Patricia would like to know, what's good for tinnitus and vertigo, Dr. Wallach? So
okay.
let's say 5'6" female, 174 pounds.
Okay. Well, when you have tinnitus, ringing in the ears, and vertigo, as the eighth cranial nerve being squeezed, when you're getting tinnitus, ringing in the ears, it's the auditory branch of the eighth cranial nerve being squeezed. When you have vertigo, balance, dizziness problems, that's the vestibular branch of the eighth cranial nerve being squeezed. And if you really think about it, you have other symptoms of osteoporosis of the skull. Okay. And so at 174 pounds, need to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, no butter, rye, no sugar, no carbonated drinks. And even the diet one's got to go. And don't forget that sometimes getting up at night, 2, 3, 4, 5, 6, 8, 10 times has to do with osteoporosis of the skull, also squeezing the spinal cord. And the spinal cord is sending messages to the urinary bladder to urinate. And it's not a prostate issue because women don't have prostate glands, but women do have 4 times the rate of osteoporosis in men. So that's why they have so many of these things. Well, this should go very, very quickly. And, we don't know, do you have high blood pressure? Do you have diabetes? Do you have skin problems? Do you have irritable bowel syndrome? Do you have diverticulitis? Do you have Crohn's disease? Did you have your appendix out when you were a kid? There's a lot of questions I would ask you if this was a live interview instead of an email.
All right. Thank you so much, Dr. Wallach. Let's go to, I have another question here from Cynthia.
Okay, well, wait a minute. I don't know if I said everything. She needs, did I say collagen peptides, a scoop of that with each, her morning drink or evening drink? She needs the MSM, 2 of those, so she can have 2 bottles a month. So you can have 3 with breakfast, 3 with lunch, 3 dinner time. That's in addition to the 2 healthy brain and heart packs. Okay. And then vitamin D3, 3 of those twice a day. And that will help get rid of the tinnitus and ringing in the ears and the vertigo, the balance and dizziness problems, but also all the other stuff that's going on, which can be more fatal. Okay. And so it's not a bad thing when you get these early warning signals. You make the adjustments in your diet and you take the supplement program properly to get the nutrients necessary for the skull to repair itself. And again, this is where the book, It's All in Your Head, and the CD, It's All in Your Head, it should be a must. This is a must for this lady, okay?
For Patricia.
For Teresa, is it?
Patricia.
Oh, Patricia. Okay, there's a second one. Okay, Patricia. Okay, yeah. So she needs to get a hold of the book and the CD, and they will be life-saving for her.
All right. Thank you so much, Dr. Wallach. Can I go forward now?
Yes.
Okay, let's go to Cynthia's question that she had put in the chat. And it is in regards to a 76-year-old male, 148 pounds, 6 foot tall. His health concern is that he had an infected knee. He was on heavy cortisone and antibiotics. Now they want to give him weekly injections in his belly to keep the inflammation down. Is there a good protocol to heal the knee, reduce inflammation, and prevent him from having this weekly injection?
Yes, he should change doctors immediately, go to a medical school, because this doctor probably has a kid in college and they need tuition. So he wants a weekly treatment so he can pay the tuition for the kid. Okay. And so when you have joint problems and you're 148 pounds, 76 years old, the odds are you have some things going on in your body from several things. So get rid of all the bad foods. Okay, the odds are that Cynthia has a gluten issue. The only people who are not sensitive to gluten are dead people. So no fried foods, no processed meats, no oils, no glutens, no wheat, no butter, rye, no sugar, no carbonated drinks. Even the diet one's got to go. And then I would have her at 148 pounds. She's right on that cusp. So we're going to go full bore here. Take 2 healthy brain and heart packs per month, a full dose of thing twice a day, 2 bottles a month of the MSM. So you can take 3 at breakfast, 3 at lunch, and dinner time. And they're going to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes bone itself, including the knees and the hips and the back and the shoulders and ankles and wrists and all that kind of stuff. Then she needs the collagen peptides, a scoop of that in her morning drink, a scoop of that in her evening drink. She also, I'd have her take the Beyond OsteoFX Plus. It comes in 3 forms. It comes in the powder. I use the powder. I put a scoop of that my morning drink and my evening drink, along with the collagen peptides. Comes in capsules. If you want to take 3 or 4 or 5 of those twice a day, capsules comes in a liquid. You can take an ounce of that twice a day, be 2 quarts a month. Okay. And it will, this combination of stuff will rebuild all the ligaments and tendons and connective tissue and the walls of arteries and veins in your skin and so on, including the knees and the tendons and so on. This is very simple stuff. But doctors want to do cortisone and painkillers because it makes the patient happy. Oh my God, I was in pain. The doctor gave me a shot of cortisone. 3 days later, my pain was gone. I just love my doctor. When I die, I'm going to leave everything in my will to my doctor because he got rid of my pain. Okay. Well, you better start writing that will because you're going to die early if that's all you did was get cortisone to deal with all these bone and joint problems, because you are going to die early. Okay. So this is all easily dealt with. I always say, give us 90 days, but you'll see great results long before that. How long do I have to stay on the diet? How long do I have to stay on the program by consciously, proactively taking these essential factors? As long as you need oxygen and water, which means as long as you're alive.
All right. Thank you so much, Dr. Wallach. And let's try St. Teresa's phone again. Go ahead and unmute. I see your beautiful smiling face. I think we might have a good connection now.
Hi, how are you? Hi, Rebecca. It's Marla in
Oh,
Kansas
Marla.
City. My phone says funny things. Hi, Doc. My question is, I have been pre-diabetes for a while, even though I exercise and eat intelligently and I do supplement. So I think the other factor, stress, I may not be managing it real well, but I look happy on the outside. I don't get it. But my A1C recently was 6.0. And Doc, I want to know, is it possible to have reactive hypoglycemia concurrent with a high blood sugar? Can it bounce back and forth?
Of course, you have to appreciate that pre-diabetes, 6.1 is pretty close to normal. Yeah, 6.1. Okay.
6.0. Okay. 6.0, but yeah.
6.0. Okay. Yeah. Is pretty close to 5.
Okay.
Okay. And so if you were 14, I'd be worried.
Well, I'm having symptoms. There are times I have blackouts, and Rebecca knows about it.
Stop.
Helping me.
Stop. Okay, you have to stop talking a minute so I can answer the 18 questions you've answered. Okay.
Sorry.
So basically, when you have reactive hypoglycemia, you eat a big meal, especially with carbohydrates in it, potatoes, rice, bread, that sort of stuff. Okay. You get your body's throwing out more, when you're pre-diabetic, your body throws out more insulin, and it drops your blood sugar down and you pass out. This is why there's so many accidents on the highway when people get killed they cross the center line to head on with somebody and both cars go in both directions. The drivers are dead because the one who crossed the center line, when they do drug tests on them, they didn't have any drugs in them. So what was going on? Well, they never take their blood sugar. They never take their blood sugar. See, and what's happening is these are the people who, when they're at home, they eat a big a big dinner, especially with carbohydrates in it, a couple of baked potatoes kind of stuff, okay, or drink a couple of Diet Cokes. They'll go to sleep. Even when they're driving, they'll just go to sleep and cross the center line. And so that's what happens there when you have reactive hypoglycemia. So you want to take the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. You want to take our Sweeties. Go ahead and take 2 or 3 of those twice a day per 100 pounds of body weight. We don't even have your body weight here. And so
100 okay. Pounds, 5'1".
Okay. So in your case, I'd get, 1 bottle of the Sweeties per month, and I'd go ahead and take 3 of those twice a day. Take 3 at breakfast, 3 at dinner time, or you could take 2 at breakfast, 2 at lunch, 2 at dinner time, for a total of 6 a day. And then, continue. And you don't need to get a prescription from your doctor to get the test strips from a pharmacy. Go get those so you can monitor your own blood sugar, say a half hour, an hour, and 2 hours after you eat and see what's going on there. You can do that yourself and don't have to run up a $500 bill to do all the lab work and the office visit and all that kind of stuff. It'll cost you, $1.50 for the test strip.
Okay. Yeah, I actually have some, and I guess I can start using. I didn't know glucose strips would tell you the same as your A1C, but I'll.
You say, see, it doesn't matter whether you can have low blood sugar or high blood sugar. It's going to tell you what your sugar level is.
Okay, and so I just need to learn how to eat so I don't spike it.
That's
and
correct.
Take the supplements.
That's right.
And
you got to take the 90. And I'd take that 100 pounds, one healthy brain and heart pack per month, half a dose of everything twice a day, one bottle of MSM. So you can take 3 of those twice a day. Take the sweeties. Okay, at very least, take 1 bottle a month. So you can take, say, 1 3 times a day with your sweeties.
Okay.
And give us a call in 2 weeks and 4 weeks and 6 weeks, because people want to hear, because this is a very common problem.
Okay, so I could have both high blood pressure at times and low blood pressure at times. It could swing in a given day or week.
Wait a minute, are you talking about blood pressure or sugar now?
I meant blood sugar. Blood sugar. Can it swing to high blood sugar that you're reacting sometimes and low blood sugar?
Yeah, it depends on what you're eating.
Okay. All right. I sure appreciate it. I have to learn to eat better. They want to give me a nutrition through the Blue Cross program. I know it won't be a holistic, but I can probably consult with Rebecca and get some.
Well, Rebecca is a good coach. And of course, okay, and it wouldn't hurt for you to get that book, Rare Earths Forbidden Cures. Go to chapter 10. It'll tell you how to collect hair. So you're doing things scientifically. In a couple of weeks, you'll get the 2 charts back. One chart will tell you about the essential nutrients, minerals, okay? And that's very important. And then also if you have a second chart will tell you if you have toxic minerals like lead and mercury, okay? And uranium and stuff like that, okay? It's called Rare Earths Forbidden Cures. And you want to get it, and so you can get chapter 10. It'll tell you how to collect the hair. You cannot get this information with blood test.
Right. Rare Earth Cures, EARTH.
Rare Earths Forbidden Cures.
Oh, Rare Earths Forbidden Cures. Okay. Thank you, Doc. Thank you. Thank you.
God bless.
Thank you.
Bye-bye.
Thank you. Bye-bye. Thanks,
All
Rebecca.
right. Thank you, Marla.
Thank you. Thank you.
Nice to see your face.
You too.
Let's go and take a break, Doc. We are at the top of the hour. You are listening to Ask Doc Live, and we just want to make sure that you are getting the information that you need in order to reclaim your health journey, because you have power. You have it within you to be able to choose your future health journey. My name is Rebecca Dukes-Kozak, and we will be right back after this short break on Ask Doc Live. All right, we are back here with Ask Doc Live. My name is Rebecca Dukes-Kozak, and if you're on live with us, make sure that you have that chat box open. Our co-hosts are putting some amazing information in that chat, and you can put your questions in the chat as well. If you don't feel comfortable raising your hand, but please raise your hand. We try to get to all of the hands raised first as we're going through the program, because we want to get real answers, to the people that are here with us. And to find that raise hand option, go to the Zoom menu, click on reactions, and you'll see a little button that says raise hand, like Russ just found. Good job, Russ. We have a couple questions, Dr. Wallach, that I would like to, let's go ahead and get you unmuted, that I would like to ask that have been asked in the first part of this program.
Can you hear me now?
Now I can hear you. Yes. Okay, so John has a question here. He says, good morning. This question is for Doc. My question is, how long should it take, in your opinion, for me to have relief of the pain in my hip? I'm taking the optimal amount of the Healthy Body Pack. Let me get to the Healthy Brain and Heart Pack, along with your recommendations of the secret sauces. I am gluten-free. I removed all the bad foods, eating 6 eggs a day. In the process of calorie restriction and adjusting these foods, I've also started exercising, mainly walking and stretching, and I am using the hip pain as my gauge for healing. Now, I have to say, as a coach, and you have somebody come to you asking questions, wanting your recommendations, they follow the recommendations. That's like a coach's dream, Dr. Wallach. And John is right there as a coach's dream. So he's just started on the program in the last 60 days. He's feeling great, but he is using a hip pain as a monitor for kind of using the reconstruction of the hips instead of having hip replacement. Do we have any type of indication when he's following all the rules about how long through your autopsies and research?
Yes. Okay, basically what you have to do, and I'm assuming you can still hear me, is that correct?
Yes, I hear you loud
Okay,
and clear.
okay. You need to make a list of all the symptoms. You know, it may have 18 different symptoms, but he's sort of fixed on the hip pain, okay, because the doctors want to give him a hip replacement. So he needs to make a list of all these symptoms. I always tell people, give us 90 days, but you're going to see some of these things improve within 3 days. You know, I've had people who were blind, and then in 3 days' time, they can go get their driver's license. They're freaking everybody out. Okay. So what surgeon did you go to? I didn't go to a surgeon. I just changed my diet and took these supplements, and my vision came back because I had osteoporosis of the skull. Okay. It wasn't an eye problem. It was osteoporosis of the skull. And so you get miracles like that. And then sometimes if the circulation is obstructed into the heart or the brain or a joint or something like that, it might take 60 days to see complete resolution or some significant improvement, okay? And so some things are going to go faster than others. So you can't give a fixed amount of time, but make a list of all the various things that are going on, from the skin, the hair color, and so forth, bowel movements, that kind of thing. And then skin issues, tinnitus, balance, and so on. And I said hair color, digestion, hiccups, all these things, write them all down, pain, restricted range of motion. And then, okay, for instance, I can walk all day. I'm 83 years old. I can walk all day and never stop, but I walk 3 miles a day. I walk 1 mile, and then maybe an hour and a half, 2 hours later, after I've done a lot of other stuff, I'll walk another mile. Then a couple hours later, I'll walk another mile. Okay, and I do 20 push-ups twice a day. That's not bad for 83 years old. Okay, and so, but in the meantime, I'm accomplishing a lot of stuff on the phone, on the computer, and so forth. And so it's one of those things where don't sit there waiting by second by second by second, where one thing is going to be fixed. Okay, make a list of all the things that's going on, and that way you say, boy, 90% of them are already gone. It's only been 2 weeks. Okay, and so some of them, their advanced issues might take you 3 months, might take 6 months. But if you're getting rapid improvement in 3 and 5 and 8 and 10 and 12 other issues, you're on the right track. So I hope that's a understandable answer.
I think that it is, because Dr. Wallach, everything within our body is connected. And
That's
when you
correct.
start getting improvements in one area, it's not just those cells, it's cells throughout the body. It just takes longer to, can I say rebuild, John T?
Yeah.
I'm trying to see, I don't have all the alphabet behind my name like you do, which proves anybody can do this. Okay. But the cells within our body, they're all cells. And some of them are soft tissue, some of them are hard tissue. So they take different amounts of time. And as that soft tissue is improving, you got to know that hard tissue is too. It just takes a little bit longer. So I know that's what I experienced anyways.
Yeah. And I just recently had a guy who had issues, and he said, well, how long is it going to take? I said, well, give it 90 days. And he calls back in 2 weeks and said, my problems are all gone.
But that doesn't mean you stop taking what
No.
helped.
How long do you have to do it? Well, as long as you're needing oxygen and water, you need these 90 essential nutrients. Okay, because you can't get them from your food. You can't guarantee you're going to get them from your food because nutritional minerals do not occur in a uniform blanket around the crust of the earth. They occur in veins like gold and silver. And once you truly appreciate what that says, okay, that these nutrients occur in veins like gold and silver. And that's why there's certain people in certain areas of the world do very well. And that's why we have, the life expectancy of people all over the world. Okay. Interestingly enough, one of the worst ones is Russia. Their average lifespan, their life expectancy is 72. Okay. Whereas the people up in Hunza, Pakistan, right on the Chinese border, okay, in the Himalayan mountains is 120. Now that's not their limitation. 120 is their average. Okay. And some of them live to be 160. They were the subject of a book and a movie called Lost Horizon by James Hilton. Okay. Yeah. Okay. And so this is a very famous story. And he was a New York Times investigative reporter. He was a critic. Boy, let me tell you, this guy, they sent him there to find out what was going on because all these people claiming they're all these long-lived ages and everything is beyond anybody's belief. So the New York Times sent James Hilton up there to investigate Dr. Lee, this Chinese doctor running around making all these people live to be 120. Okay. Well, it turned out it was true.
Well, I'll tell you what, Dr. Wallach, 7 years ago, I didn't want to live to be 120 because I hurt so bad. Now, bring it on.
Well, now every time I see you get out of the car, you're dancing into the front door, you're dancing up the steps. So very proud of you. And you're a good example of what can be done if you do all the right stuff and pass on the message to other people. I'm very excited. We're building a huge team, and I can't thank you and Ask Doc Live team. I can't thank you enough for getting this information out there.
Well, I love the fact that Dr. Wallach, we can bring everyone together. We don't stick with just our team. We are here for everybody and helping them have resources that they need in order to reach around the world. We are not one man for himself. We are family. And that's like our co-host team. We're different teams, but we're coming together because we have the passion of helping others. And I love that. And we have some questions here in the chat. Okay. From more, and I know some of them are team members, but I think there's many of them that are not. And Miriam wants to know, is there a supplement program that can help somebody with a marijuana addiction to wean themselves off of it? And then I had an email that was coming in, Dr. Wallach, that you might be able to address at the same time on alcoholism and addiction. So is there nutritional deficiencies that are kind of aiding in being pushed towards addiction in general?
Yes, whether it's obesity and eating too much, okay, whether it's experimenting and trying marijuana or experimenting and trying alcohol. Okay, come on, Santa Claus drinks alcohol. Grandma used to leave a glass of wine out for Santa Claus every
I
Christmas
thought it was
Eve.
Milk. I always left milk.
Well, it's the milk of grapes.
Oh.
Okay. So at any rate, you have to appreciate that when people have addictive problems, whether it's alcohol, whether it's drugs of any kind, whether it's prescription drugs or illegal drugs, whether it's alcohol, okay, or food and becoming obese, these addictions are all caused by nutritional deficiencies, and the patient or individual develops a behavior called pica, P-I-C-A. Look it up. Ask Siri, what's the definition of pica? It's an insatiable desire to eat, okay, because your body wants stuff. And if you're missing this stuff, your body tells you to eat more, okay? And so if you choose poorly, you're going to have a bad result. Alcoholism, drug addiction, alcohol, and of course, obesity, and so forth. So it's essential that you get a hair analysis when you have this addiction. And it's called pica, P-I-C-A. Pica is the name given to this. And you see this in animals, okay? In horses, they call it cribbing, where the horse, you put them in their stall at night and they sit there, they eat the top rail in their stall. You come back in the morning, the top rail in the stall is eaten through. Well, why is that? Well, that's because the horse was missing something, and the horse's brain is telling him, you better eat and get this stuff. And the only thing that he had within reach was that top rail in the stall. So it's called cribbing. But in humans, it's called pica. When babies do that in their crib, it's called cribbing. Okay, they're missing stuff. And of course, the baby's not going to get alcoholism or drug addiction unless the mother's doing that and breastfeeding the baby. And so the drugs and the alcohol are coming through the breast milk. I've seen babies that were just, 3 months old that were addicted to drugs. Where in the heck they get that? Well, the mother's addicted to drugs. They're coming through the breast milk. Okay. And so this is very basic biological stuff. Okay. And of course, again, it's in the book, things like Dead Doctors Don't Lie, the CDs in 9 languages. Get a hold of that book, Rare Herbs and Cures, get a hair analysis. You'll be amazed. Go to chapter 10, tells you how to collect the hair, where to send it. Don't forget to write the check and send it with it, because the lab won't run the test without the check. And it's one of those things where this is very, very simple. It's been well established over the years, and we deal a lot with people who have pica and they're obese. And the reason why our weight loss programs work is because we not only deal with cutting calories, but we deal with giving them the nutrients that are necessary to make them stop eating. Okay, so when doctors give you a prescription, okay, for obesity, what they're doing is giving you something to change your metabolism or this, that, and the other, which is not the right answer. Okay, you need to stop eating. Well, if you're missing these nutrients and you have pica, you're just going to eat 25 meals a day. Okay, and that's how we got in trouble. And
Guilty.
Hello?
I was guilty.
Oh, yeah. And so you had pica, and once you changed, I'm very proud of you. You lost 100 pounds, and you're a very special person, because you're sharing your story with other people. And what should I say? You take these essential factors, and so you're not eating all day. You're just not eating all day like you used to do.
Well, and one thing, Dr. Wallach, is media and another establishment gave me the permission, because of certain different things, to eat 6 meals a day.
Woo.
They were saying that it wasn't healthy to do a big meal here and a big meal there, or even a medium-sized meal, that you needed to graze all day long because of my blood type.
Well, there's a science called crapola.
Yeah, that crapola added on a lot of weight. Yes.
Yeah. So see, that's because doctors didn't know what's going on. And so they're just looking at all these people who gain weight or eating all the time. And so they say, well, that's just in your genes. No.
No, and I really thought that it possibly was. And I didn't have a weight issue until I was in my 40s. I was taller than all the other females in my family. I was thinner than all the other females in my family. I had child number 4, and oh my goodness, it was like blowing up a balloon. Seriously, I put on 120 pounds. And
over what period of time? 3 months, 6 months, a year?
So from 5 months pregnancy, then he was born 5 weeks early. And then I had put on 60 pounds. And right after he was born, within 3 months, I had put on another 60 pounds.
Wow.
So it was pretty devastating. It really was. And no matter what I did, it seemed like I gained more and more weight.
That's because you were minerally deficient, and your body is saying, come on, girl, eat, find that stuff and get it.
That's it. I was like, okay, I felt like I was starving all the time. But
No,
then
you
when
were
I started on
not
the
for calories. You're starving for minerals.
That's right. When I started on the supplement program, I was able to control those cravings, and I wasn't even trying to lose weight. Weight was not my big condition, my big issue. It was the pain from the herniated discs, from the torn hip capsule, from the migraines, from the all over body pain that I was experiencing. I just wanted some type of relief because I couldn't take the narcotic pills to kill the pain. I needed something. And I got it. I got it. And now
Thank
I
you for
don't even
sharing.
think about needing any of that. And I could go, most of the day and not even think about needing food. So it's neat that I don't have my life focused around food anymore. So I just focus around
See.
my supplements and getting what I need and feel great. And
See, so now isn't that something that you know more about weight gain and weight loss than most doctors do? Okay. They think you just have a bad habit, you can't control yourself, that kind of stuff. They don't know it's due to a nutritional deficiency, particularly of minerals.
yeah. And it was simple. It was so simple.
Well, we're very proud of you.
So simple, I wasn't even trying. But I have lots of other people, Dr. Wallach,
Okay,
that are
let's
wanting
go.
to know answers also.
Okay, let's go.
So Yvonne is writing in for Jason, which I didn't see. Oh, Jason's back here. Yay. All right, Jason, go ahead and unmute yourself. Perfect timing. You're on live with Dr. Wallach, Jason.
Hey, good morning, guys. Good morning, Dr. Wallach.
Good morning. Okay, how old are you and how much you? Okay, now wait a minute. I'm getting a lot of echo and feedback here, so you got to watch what you're doing here. So how old are you? How much do you weigh?
I'm 24. I'm about 170.
Okay. And what issues do you have you want to talk about?
It's not particularly me. I don't have like any issues that I'm concerned about. My boss, he just had knee replacement surgery.
I'm sorry, back again. Wait a minute. Yeah, what kind of surgery?
Knee replacement surgery.
Oh, knee replacement. Okay.
And he got like blood clots after a few weeks, and now he's doing like physical therapy, and he's in a lot of pain. Like he keeps doing the stretches. I've
Sure.
recommended you the products like the Osteo FX and the
Okay.
Start Pack. I got mine right.
Okay. Okay. Well, one of the things you need to learn, Ron, and you're on the right track. So I give you all kinds of kudos and applaud. So thank you for thinking of your boss and so on. But one of the big mistakes people make, they want to know the nutrient. Give me the nutrient. I'm going to take that one nutrient. Well, what about the other 89? Okay. It's kind of like, what if you have the very best pistons in your car? Okay. And you're out there sitting on a park bench with the pistons in your lap. How far are you going to go with those pistons in your lap? You're missing the car.
Yeah. No.
Okay. Okay. And so that's the same thing that happens when you think about one nutrient. Give me that nutrient. Oh, I have an iron deficiency, so I'm anemic. So I took iron, but it really didn't help. Well, for your bone marrow to make red blood cells, it requires 90 essential nutrients, not just iron. Hemoglobin requires iron, but for your bone marrow to be able to make hemoglobin, it needs all 90 essential nutrients. Got it? So he needs, okay, at 170 pounds, he needs to get rid of all the bad foods, no fried foods, no processed meats, no oils or gluten. Now, did he have a knee repair or a knee replacement?
It was a replacement.
Okay, so he'll have to keep that artificial knee forever. Okay, but
he's 59. I was saying my weight and age. He's 59 years old.
Okay, 59 years old. Okay, 59. Okay, and so about double your weight. Okay, so age, excuse me, double your age, 59. So he needs to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten. And this includes air frying, no wheat, bread, rye, or oats. There's no such things as gluten-free oats. You need to stay away from sugar, no processed meats, absolutely, no ham, no bacon, no carbonated drinks. If he wants to have energy, he can use our Rebound. We have the sticks We have the canister. We have the cans, but the cans do have carbonation in them. So I pop my cans during the evening, put them in the refrigerator. I'll drink it at morning for breakfast. I'll put 2 of them in there so I can have one for breakfast, one in the evening, but I'll pop another one in the evening and put it in the refrigerator so it's off gases and it's flat by morning. Okay, gets rid of all the carbonation, maximize absorption. And then he needs to, at 170 pounds, take 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, full dose of everything twice a day. Then he needs 2 bottles a month of the MSM, so he can take 3 at breakfast, 3 at lunch, 3 dinner time, and they will help support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between a vertebrae, bone, makes your bone itself, and skin and heart valves and all that kind of stuff, the walls of arteries and veins. And then also needs the collagen peptides, a scoop of that, and the breakfast drink, scoop of that in the evening drink. And does he have any other issues like high blood pressure or diabetes that you know of?
Not that I know of. I got him on the collagen peptide.
Okay, good. Okay, good. Yeah, he needs a scoop at breakfast, scoop at dinner time. And then you need to ask him the other questions. Do you have any other issues? Any diabetes, any high blood pressure, any ringing in the ears, any dizziness? You understand what I'm saying? You need to answer a few more questions here. Any hiccups, any belching, burping, bloating, those kind of things, any constipation, diarrhea? Did he have his appendix out when he was a kid? That tells you the only people who are not sensitive to gluten are dead people. Everybody's sensitive to gluten. Okay, nobody should be eating gluten. The only people that should be eating gluten are doctors. We should save all our gluten, and because we love our doctors so much, every doctor should have gluten 5 times a day.
No, definitely.
Okay. So let us know how it goes, because your boss will do very, very well, because he does have an artificial knee. We will regrow the bones around that artificial knee, and so it won't wobble around in there and cause him a lot of pain. So you want to make sure that all his bones, his femur, his tibia and fibula, and all of his bones in the upper leg and the lower leg are normal and holding on to that knee, okay? And that will prevent a lot of pain.
All right. Thank you so much, Jason.
Thank you guys very much.
Have a
Okay,
great
good.
one. And
Yeah,
make
God
sure,
bless.
see, he's got it. I would like to recommend though that you get a different bottle for your Beyond Tangy Tangerine, something that's like BPA. Glass would be best, so you're not getting those plastic toxins absorbed into your nutrient drink there. But keep going, buddy. You're awesome.
Appreciate you guys and everything. You guys.
Thank
All
you.
right. Take care and be safe. Be safe.
Will do. Thanks.
So, Dr. Wallach, I want to go to another Jason, though, because here we have a question that's coming in from Yvonne. And let me get back to it. I apologize. So,
You said
we have
Yvonne?
had so many questions up in the chat. It is fabulous. Plus the hands. We've got another hand up. But this Jason is 50 years old, 5'8", 160 pounds, confined to a wheelchair with severe trigeminal pain for days now. He does have a diagnosis of Guillain-Barré syndrome.
Oh,
Because of this, he has had 3 brain surgeries. How can we help him with the trigeminal neuralgia pain?
okay. Well, trigeminal neuralgia is the 5th cranial nerve being squeezed by osteoporosis of the skull. He's got Guillain-Barré syndrome. We talked about that in the CD, which came out a year after the book came out. And so there's so many symptoms of osteoporosis of the skull and of MS, multiple sclerosis. And multiple sclerosis in kids under the age of 25 is called Guillain-Barré syndrome, named after 2 French doctors in 1916 who described MS in kids under the age of 16. Okay, that's kind of crazy. They're under the age of 25. It was 1916, and so at any rate, this guy here, confined to the wheelchair. Okay, he needs to stop having brain surgery. Okay, trigeminal neuralgia, very easy. It's the 5th cranial nerve being squeezed by the skull. And there's a lot of this stuff I'm sure is going on where the skull is squeezing the spinal cord. And so everything south of there, we want to know how many times a night he wakes up to urinate and all that kind of stuff. That'll be very important. That'll give some sense of the amount of damage in there. But at 160 pounds, needs none of the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, bread, rye, oats, no sugar, no carbonated drinks. Even the diet one's got to go. Use our Rebound instead. If you're going to drink the can, pop it at night, let it off gas in the refrigerator all night and drink it in the morning. If you want one in the afternoon also, then put 2 in the refrigerator at night. But make sure that they're open so that they off gas carbonation. And then let's see here. Needs 2 healthy branded heart packs per month. He's 160 pounds. Need 2 healthy branded heart packs per month to full everything twice a day. He needs 2 bottles a month of the MSM so he can take 3 at breakfast, 3 at lunch, 3 at dinner time. And that will support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone itself, skin, artery walls, vein walls, all that kind of stuff. Okay. Also the covering of the brain and valves in the heart and all need all these nutrients. Okay. And then let's see here. We want him to have let's see here. We said the MSM. We also want him to have the collagen peptides and scoop of that in his morning drink and scoop of that in his evening drink. We do want him to use our Rebound sports drink. And also we want him to have our Ultimate Daily Classic tablets. We want him to have 2 bottles a month. So he can take 3 at breakfast, 3 at lunch, or 3 at breakfast, 3 at dinner time. And that's going to help support healthy blood flow through blocked arteries everywhere and support healthy blood pressure. And the fact that he's had brain surgery, okay, and been diagnosed with Guillain-Barré syndrome, we know that he has the problems going on with the nutritional deficiency of a substance called cholesterol. So he needs those 3 eggs twice a day with soft yolks, soft boiled soft yolks, soft poached soft yolks, soft scrambled butter. I only weigh 142 and I do that, okay? And I don't have any problems, but I do that to prevent problems. But he can reverse all his problems, okay? And we get so many people get out of wheelchairs. This is very easy, okay? But he's got to do exactly as I just said. And Guillain-Barré syndrome, I want to know how old he was when he was diagnosed with Guillain-Barré syndrome. He's 50 now. Was he diagnosed with it when he was 25, when he was 20, when he was 40? I mean, when was he diagnosed with Guillain-Barré syndrome? Okay, but usually it's in kids under the age of 25, but it's the same disease as MS, multiple sclerosis, which has many of the same symptoms as osteoporosis of the skull. And so you can have both at the same time, would not be unreasonable to see. Okay, but also it's very easy to get rid of, which we just outlined.
All right. Thank you, Dr. Wallach. And again, everybody, there's a lot of information that's being shared here. And I love the fact that we are touching on so many different subjects because we're all individuals. We all have or have had different symptoms. And if you have a symptom that is being mentioned today, or you know somebody that is experiencing some of the things that we're talking about, be empowered. Give us 90 days on one of Dr. Wallach's protocols specifically for what you are experiencing. Your body will thank you, but we want to make sure that you get back with the person that shared this program with you and thank them also, because it's life-changing. And for somebody who did supplements, Dr. Wallach, since I was itty-bitty, but doing the wrong ones and then finding the right ones and feeling the difference, I can't stop but encouraging others to feel the difference also.
And people, you know, they say, well, I'm taking vitamins and minerals. Okay, they're taking like 12. You need 90. They're taking 25. You need 90. Okay, and so, and usually they're taking lots of, I even get people say, yeah, I supplement every day. Well, what do you supplement with? I take vitamin C. Well, what else you take? Well, I just take vitamin C and I eat well. Okay, well, that's why you have 14 different diseases. You're on 14 prescription drugs. Your doctors want to amputate half your body. Because you're not
at least
doing it
replace
correctly.
it. Yeah, take it out, replace it. Well, and Dr. Wallach, as I'm working with people, I'll have, you know, a whole list of things that they're taking, but they're taking this from this company, this from this company, this product, singles, you know, cherry picking.
Mm-hmm.
and it's not working together. And then just because something is a nutrient, there's so many different forms of that nutrient. Not all of them are essential, right? And not all of them can the body actually absorb and utilize to our body's best use. And that's what I love about the longevity products, is they are formulated to work together. They're in ratios that through your work have been determined to give the best outcomes. So again, we just encourage you to get back with the person that shared this program with you and say, okay, sign me up. I'm giving you 90 days. But when you're feeling fabulous after those 90 days, that doesn't mean you quit, because then you go right back to what you were doing that got you feeling horrible in the first place.
This is a lifetime deal.
It's a lifetime deal. That's right. I'm 90 for life, Dr. Wallach.
All right.
Guaranteed. Well, Yvonne has another question we'll hit real quick, and then we'll go to our next hand that is up. Spinal cord atrophy from an accident that caused spinal fracture per X-ray and MRI. This gentleman's spinal cord is shrinking over the past 20 years since the accident, and it has caused his muscle atrophy in hands and adductors and legs. You might know what that means. He's 50 years old, 6 foot, and 170 pounds.
Okay. All right. And so you have to appreciate that he was in an accident. Okay. And he had some injuries, I'm assuming, to his neck and his upper back and whatnot. Okay. And so everything south of there was in trouble, because whether it's your skull squeezing the spinal cord or an accident causing scar tissue to squeeze the spinal cord, everything south of there is getting mixed messages or no messages. Okay, it might even be a circulation issue as well. Okay, and so somebody who's 170 pounds that has all this spinal cord atrophy, okay, and muscular atrophy, okay, and spinal everything south, okay, they need to get rid of all the bad foods. It's the same old recipe: no fried food, no processed meats, no oils, no gluten, no wheat around oats, no sugar, no carbonated drinks. Either the diet one's got to go, and no air frying either. Okay. And then at 170 pounds, they need 2 healthy brain and heart packs a month, and full dose twice a day. They need the MSM 2 bottles a month, so you can take 3 at breakfast, 3 at lunch, 3 at dinner time to help support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone breaks bone itself, which has to do with the spinal cord atrophy. Okay, it could be blood supply, it could be squeezing of the spinal cord by scar tissue in the vertebrae and the disc and all that kind of stuff. Same thing with muscle atrophy. It could be a lack of neurological talking to the muscles, or blood not getting optimally at levels to the muscles and so on. And so additionally to the MSM, collagen peptides, a scoop of that with a morning drink, scoop of that with the evening drink. I like the Ultimate Daily Classic tablets. Take 3 of those. I'd go with 3 times a day, maybe 3 bottles a month, or small bottles. And that's going to support healthy blood flow through blocked arteries and support healthy blood pressure in the brain, in the heart, in the liver, and the kidneys, and all that kind of stuff. And don't forget, 3 eggs twice a day. It wouldn't hurt to have 3 eggs 3 times a day with soft yolks, soft boiled, soft eggs, soft poached, soft eggs, soft scrambled butter, soft yolks. Okay. And so this is very, very important to rebuild the spinal cord. Remember, the brain and the spinal cord is 25% by weight cholesterol. Do not take statin drugs. Okay. Only people who want to have Alzheimer's disease should take statin drugs. If you don't want to have Alzheimer's disease, don't take statin drugs. This is very well documented. And remember that the normal person, the normal brain and normal spinal cord of a person is 25% by weight cholesterol. And your body makes cholesterol, and your body wants to eat cholesterol. Every cell wall in the body contains cholesterol. And so this is a required nutrient, cholesterol. And doctors treat it like it's the enemy. And that's why we have Alzheimer's disease. Alzheimer's disease is a creation of doctors. It did not exist. Now, there's all kinds of dementia, senile dementia, okay, hypoglycemic dementia and so forth. All right. But then once they started taking statin drugs because they falsely believed that cholesterol caused plaque and blockages in the arteries, they started taking statin drugs in the 1950s. By 1960, Alzheimer's disease was the biggest disease we had in the world. It was spiking like crazy because they were cutting off the normal supply of the nutrients necessary to make and support the brain myelin, the white matter of the brain and the cell walls in every cell in the body. So I hope that answers the question.
Yes, thank you so much. So, folks, cholesterol is not the enemy. And you take the cholesterol away, and it's just going to open up that can of worms of issues in the brain, down low, throughout the body.
Yeah, and
We need
cholesterol,
cholesterol.
cholesterol makes up 95% of the weight of testosterone and estrogen. And so you have all these issues, ED and menopause, all this kind of stuff. These folks need to be eating 3 eggs with soft yolks twice a day. Get off of statin drugs, and they won't have those issues anymore. So ED, menopause, Alzheimer's disease, all these things are a product of misinformation by the medical system.
That's right. And I just want to thank you, Dr. Wallach, for all that you do. And I also want to thank the gentleman that is responsible for Ask Doc Live, MZ Michael Zerling. Welcome, Michael, to the call. It's always exciting to have you here. If you want to unmute yourself and say hello, please do.
Hello to everyone, to you, Becca, to Doc, to Dr. Judy, to Heather. Oh my God, how many people am I gonna forget to? Oh, to Ruth Ellen, to Nasima. Oh my God, there's Nasima.
John T.
And there's Dennis H. and B. iPhone Linda. That's good. And geez, how many people? I'm gonna take up the rest of the meeting greeting everybody.
No, I'm not gonna let you, Michael.
Okay, good. Okay, but you're gonna be the one, you catch the hell from my not, mentioning everybody. Okay, not me, because I was ready to. Okay.
Yes, and thank you, Michael, because we have 63 people on live with us right now, and I've seen it higher. We were up a little bit farther, but we just want to thank Anita, Barbara, Beatrice, Bill, Beam C, Kathy, Christiane, Danny, Denise, David, Dennis, Dawn, Donald, Faye, GB, Gary, Greg, Hilda, Deborah, Linda, Jason, John, Karen, Kathy, Ken, Lucy, Mark, Maria, Miriam, Myrna, Nancy, Pamela, Patricia, Peter, Robert, Shelby, Sonia, Susan, Tibos, Uwa, hello Uwa, Verna, and Yvonne, and Win7 Alt. I'm not sure who that is. And then we have area codes 201, 205, 209, 240, 716, 847, 925, HF. And see what can of worms you opened up, Michael? Thanks, MZ.
The only people missing were Paul and Mary.
That's right, Paul and Mary.
Well,
we'll have a fix song that by Paul and Mary that you sing, don't you?
A what?
Don't you have a song?
Dear Paul and Mary?
I don't know. There are lots of songs. You don't want me to sing for Ask Doc Live, do you? That would be awful. Everybody would hang up. Everybody would go away. You don't want to do that. But Doc and I go back with Dead Doctors Don't Lie radio show like 26 years now. It's unbelievable. Yeah, I mean, where did that? It just seems like 26 minutes, right, Doc?
Mm-hmm.
Wow.
Yeah, we've been doing it a long time. We've helped a lot of people, and we're just very, very grateful for the opportunity to be there for them.
Yeah, that's terrific. So, yeah, and you guys are going really strong on Ask Doc Live. That's fantastic. So, And you never rest because you're always doing radio or Zoom meetings or something, right?
That's why I take the 90 essential nutrients.
That's yes, because if you didn't take the 90 essential nutrients, you could not do as much as you do or anywhere near it. I'm sure.
Yeah. Well, the odds are I'd be dead already.
Right. Okay, gang. Well, good.
Thank you. Thank you,
Thank
Michael.
you, MZ. Always nice to have you here. We appreciate all that you have done to make this program possible and getting Doc on the air and around the world. So I'm super excited to be part of that as well.
Mm-hmm. Yeah, Michael started it all, internationally. So very proud of our association with him.
Awesome. So you're muted, MZ, but I'm going to keep you muted because we have a couple more hands before the end of the show, my friend. Sorry, boss.
Let's go.
Michael, another Mike in a different part of California. Unmute yourself. You've got a question for Doc Wallach.
Hey, Doc, this is not for me. It's for one of my clients. I'm all
Okay.
good. I've been on the nutrition for almost 2 years now, and I don't take any more medications, and my
Okay.
health is beyond excellent.
Thank
Anyway,
you.
I have a client. He's 53 years old. He weighs 170 pounds. He's 5'8", and he's got trigger finger. I've had him on the protocol for about 9 months. He's retired now, but he's a golfer. And he keeps getting trigger finger, and the doctors have put an injection in his hand a few times, and that takes care of it. But then it keeps coming back, and they want to do surgery, but he's not going to do that. What could we do for him? I mean, he's on the MSM three times a day, collagen, healthy brain and heart pack. He exercises and diets, and he's just going crazy with his trigger finger.
Okay. Well, what he needs to do is make sure he gets rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens. Even there are no such things as good oats, because the gluten in oats is called gliadin. No sugar, no carbonated drinks. Even the diet ones got to go, because the carbonation neutralizes stomach acid, so you cannot absorb minerals and digest food. At 170 pounds, he needs 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month, the full dose of everything twice a day. He needs 2 bottles of our collagen peptides, so he can take, one bottle of collagen peptides, so he can take a scoop of that with his morning drink, a scoop with his evening drink. He needs 2 bottles a month of the MSM, so he can take 3 at breakfast, 3 at lunch, 3 at dinner. And they're designed to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone makes bone itself. And the trigger finger, he could be due to osteoporosis of the skull, squeezing the spinal cord as it's coming out the back end. And this is very common. It's what's called a peripheral neuropathy. And so I'd want to ask him questions. How many times a night does he get up to urinate? None, once, 3 times, 5 times, 10 times? I want to know, does he have any clicking in his shoulders or elbows? Does he have any clicking in his knees? Does he have hammer toes? And so forth. Did he have his appendix out when he was a kid? All this stuff needs to be asked. But in the meantime, at 170 pounds, he needs, again, let's see here, the MSM we talked about, the collagen peptides we talked about. He also needs, I'd throw in the Beyond OsteoFX, a dose of that 2 or 3 times a day. Okay, either the powder, the capsules, or the liquid, whichever one. And then the Ultimate Daily Classic tablets. Take 3 of those twice a day. That's 2 bottles a month to support healthy blood flow through blocked arteries in the brain and the skull and replace cells. And he needs to get a hold of the CD and the book. It's all in your head, and read it. And he'll say, oh my gosh, well, here's why I got trigger finger. Because it talks about these peripheral neuropathies, okay, in the book. It's all in your head. In the CD, it's all in your head. These things are all reversible, but it's a matter of diet and a supplement program. And so he needs those, the book and the CD, so he can read it every night and work on it 25 times a day.
Okay, thank you.
You bet.
All right. Thank you, Mike. And let's go right on over to Cynthia, Dr. Wallach. Cynthia, go ahead and unmute yourself. I know you had another question as well.
Hello. Oh, okay. We can't hear her.
Okay, Cynthia. Cynthia's question is in regards to, I believe, the muscle mass and loss of muscle. She has a client or friend who has been taking Glucerna, a meal replacement, to try to help rebuild that muscle mass. Now, Dr. Wallach, the second ingredient in Glucerna is canola oil.
Well, there you go.
So share with us a
no
little
else.
bit about meal replacements and what's needed in order to regain muscle mass. Cynthia, I can hear little bits of noises, but I'm not making out your voice, my dear.
Okay, so here we go. Really, there needs to be high quality food of every subdivision of food. Okay, needs to be high quality protein. And here's where 3 eggs twice a day with soft yolks will work. They need for breakfast this morning. I had eggs. I had let's see here. I had chicken of the sea. I had tuna. I had rice. I had orange. I had my Rebound in the can with it was off gas from the carbonation. Let's see here. What else? Oh, I had the let's see here. Oh, I had the dairy products. Okay, I had dairy products. Okay, and so I either have cheese or I'll have what? Yogurt, yeah, that kind of stuff. Okay, for breakfast. So this morning I had 2 of those little cups of yogurt and so on. And I had tea and I had the Rebound that had been off gas in the can. And so it's one of those things where I have a big breakfast every morning. And then for lunch, I'll have a couple of cups of mixed salted nuts, no peanuts in there because they cause fungus that grows in peanuts causes liver cancer. So I get the ones with no peanuts in them. And then I also had, I think pretty much that's it. Okay, I did have the oranges, I said that, and so on. I peeled the fresh oranges myself. Okay, and so this is, and then I had all my supplements. Okay, I mean, I take probably about I don't know 80 different supplements every morning. Okay, that's a healthy brain and heart pack plus all these others. I have a whole desk that's covered with them, and I make about 25, 30 bottles of, and then when I get down to the last 4 or 5, I make 25 or 30 more bottles again. And you're a witness. When we are out on the road, I'm taking all those things just like I do when I'm at home. I never fail. And so it's essential that you do this constantly, okay? And so the loss of muscle mass can be due to a lack of nutritional minerals, a lack of nutrition because blood vessels are blocked. It could be due to calorie shortage, okay? All kinds of stuff. Get a hair analysis. That's a big thing. Get the book, Rare Earths and Cures. Go to chapter 10, find out how to collect the hair, where to ship it. Don't forget to put the check in there and find out what level all your nutritional minerals are at. Are they all below the bottom line, which means you're not absorbing? If half of them are in the right area and half are not, okay, that's easily fixable. What if you have no toxic metals? You've been thinking all your life you've had toxic metals because you're in the military. Well, that shocks a lot of people, but it gives you also a lift of a burden that you don't have to worry about those toxic metals because they would have showed up in the hair analysis. You cannot take a blood test to see if you have toxic minerals in your body, okay? And so you might be able to find out a little bit about that if you get a biopsy of your liver. Most people don't want to get a biopsy of the liver, so it's much easier to get what I call a hair biopsy, okay? Get that book, Rare Earths and Cures, go to chapter 10 and do that. Do it once a year. And that'll be a good investment in your health because it tells you what you need to do to keep everything where it needs to be. So that's my recommendation there.
All right. Thank you so much, Dr. Wallach. And if I could get our co-hosts listed up here with me, shown up here with me, because, everybody, we just want to thank you so much for joining us here on Ask Doc Live. And for those of you who are on live with us, having your name is so important because then we can get, for some of you have faces and names. And I love that because I talk to people on the phone all day long. And like Marla, I had never seen her beautiful face. So I love the fact that we're able to put faces with names and voices. And Doc, we're helping people around the world be able to get that smile, whether it's on the face down low, in the eyes, in the hair, you know, let's be happy from the inside out, folks, and just be excited to take that first breath every morning as we're getting up, getting out of bed, and being able to look for a new day. And I know for me, with experience with different things, when my body was not deficient, I didn't have those addictions. I know that's a question a lot of people ask. Well, what causes addictions? Well, yes, emotional state is going to take a big part of it. But when our brains are nutrient deficient, including the cholesterol, we're going to have a harder time processing stuff. So we want to make sure that we are not mineral deficient. We're giving our bodies, every single cell of our bodies, what it needs so that we can take and step out and be that light in a world where there's a lot of people searching for something different. Dr. Wallach, thank you again for joining us here on Ask Doc Live. We appreciate you. Jonty, thank you for putting all the technology together, the Ask Doc Live website, the Critical Health News website, the newsletters. If you are here because you are part of our newsletter or you want to be part of our newsletter, go to criticalhealthnews.com, right? And sign up for our newsletter. And I think the sign up is also on Ask Doc Live. I can get a yes, no, maybe. He's thinking about that, but I think it's
there's a separate newsletter for Ask Doc Live.
there we go.
Yeah.
So hey, I don't know about you, but I get spam mail all day long. But I love the mail that actually gives me information that's going to help me benefit life. So sign up for our mail. We promise we won't spam you. We do not sell your information to anybody or share it. It's safe with us. You are watching Ask Doc Live. Again, my name is Rebecca Dukes-Kozak, and join us next time. But most importantly, share this video with somebody else. Show that
Thank you
care.
so much. Thank you so much,
Bye
Ms.
for now.
Rebecca.
Thanks,
Bye-bye.
Doc.
God bless. Bye-bye.
All right, God bless. Mwah.